The stars are bright, we own the night. The stars are bright, we own. The stars are bright, we own the night. The stars are bright, we own. The
Hello. Hi.
Hi.
How you doing?
I'm well. How are you doing?
I'm doing great. Great.
Can you hear me well? I'm on the iPad.
Yes,
And
I can hear you in my ear thing.
okay.
Hopefully they can hear us.
I have headphones too, just in case no one wasn't able to hear us.
Yeah, I think we're good.
Okay.
I've got this is the third one. So it's funny, I ask people, can you hear me? And no one says anything. So I'm like, okay, I guess you can hear me. So how was your day?
It was pretty good. Productive.
Very good. Very good.
2 appointments, gym, then home, prepare for this. So.
Yay! Thank you so much. So people are kind of coming on. It's 7:01 my end. So what we're gonna do, relax. This is just like a regular conversation, just people looking in onto this conversation. So just, don't be nervous.
Good.
So what I'm gonna do, I'm gonna give a little bio about you, and then we're just gonna chat.
Okay.
From there. Okay. So hello everyone who's on. So tonight, for no better time than the present, which is this IG series that we have, and tonight we have Thomas Goode. Okay, Thomas Goode is a multiple myeloma survivor and advocate. So he was diagnosed with multiple myeloma in 2005. He began his myeloma advocacy early within his diagnosis by spreading the knowledge about stem cell transplant to other patients who were newly diagnosed. He was surprised by how his impact and sharing resonated with so many, thanks to the help of his medical team, who encouraged him to speak to other patients about transplants. His advocacy has grown by him participating and interviewing with Myeloma Voices, IMF, as well as Cancer Industries on other myeloma-based projects. Thomas has also started a myeloma support group in his area in North Carolina. Welcome, Thomas.
Thank you. Thank you for having me. And
You're so welcome.
Such beautiful words for me.
Oh, you're the best. It's funny because, how is it? I forget who followed who, but I know, I can say probably, I think we connected maybe 2 years ago or 3 years ago, something to that effect. And I was like, go ahead.
It was right after Healthy Voices.
Yes.
Because
yes.
you went to Healthy Voices, and I was interested in going to Healthy Voices, and we talked after that.
Okay,
and
right.
The very next year was COVID. So
yeah, then that doggone COVID. Yeah. But it was just funny because, I did a little research on you and, where you've spoken and all of that. And I was like, 2005. So you've been in this game way past me. So you know what it is.
Yeah.
You know what it is. So do you want to tell people a little bit about yourself?
Sure. First, hello again, everybody. And like Yolanda had said, diagnosed in 2005. It was really ironic how I was diagnosed because I was working out in the gym, and I was feeling excruciating pain in my shoulder. And, you know, I know the difference between a workout pain and a regular and pain. And this basically was a pain that I'd never experienced before. So, you know, vacation went away and I went home and I was playing ball in the yard. Felt excruciating pain once again. Went straight to my family practice doctor, where they got there and they took my arm and they moved it up and down and side to side and said, "Oh, you have bursitis." You know, that was something that I couldn't take. You know, being right hand dominant, they couldn't give me that diagnosis and I could stick with it. You know, if it was my right arm, maybe, but in my left scapula, I can't take that diagnosis. So I went and got a second opinion from my orthopedic surgeon, because he had done meniscus repairs on my knees, and he was a back specialist as well. And he did the test that we always look for, X-ray and MRI. And, you know, he sent off the results. He sent off for the results. Results came back, showed I had a tumor in that area. So he biopsied that tumor and then sent that off again. And when I got the results, he said, "Hey, you have a plasmacytoma in that area." I said, "You know, explain that to me, break that down for me." And he said, "It's a cancerous tumor that's just isolated in one area." And, you know, like everybody else, when you hear the word cancer, I didn't hear anything else. You know, I just heard cancer and I stopped listening to him. So after I came to, pretty much, he explained to me what's going on. He said it's a cancerous tumor that's isolated in one area. And he said the best way of treating this particular tumor right now is radiation. So he introduced me to an oncologist, and the oncologist put me through to a radiation doctor. And I did 6 weeks of radiation to alleviate the tumor. You know, after that, I was just being monitored with lab work for the next approximately 6 to 8 months. And in around December of that next year, I was feeling excruciating pain again. This time it was in my lower back. And I went back to him because I already knew that what he was going to do, X-ray and MRI. And this time the results showed that I had a mass. I had a tumor on my lower spine, my T12 L1 area. And there was one in my rib as well. So he was like, he sent me back to that oncologist, and that's when I officially got the multiple myeloma diagnosis, because it was located in 2 areas. You know, that's the only difference between a plasmacytoma isolated in one versus the multiple myeloma. It was in more than one area.
Right.
So after that, I did more radiation. And from the radiation, I started a cocktail of medications to get my numbers down. During that cocktail of medications, they introduced me to the bone marrow transplant team at Duke. And I was doing workups over here, and then I was chatting with them to talk about what a stem cell transplant was about. So after my 3 cycles of my induction therapy, which is totally different from what people receive now, I went into collection for stem cell transplant, and initially went on into my first stem cell transplant. 2 months after my transplant, my doctors noticed throughout my lab work that the cancer had returned. I did some more labs, some more extras, another MRI, and it showed that the tumor was still there in my lower back. So I started more radiation, and I started another round of medication to get my numbers back down. So my doctor checked the bone marrow registry, and well, before the registry, she looked at me and she said, "You're very young." At the time, I was only 36. And she said, "You have a huge family, so let's test them to see if any one of them is a match for you." And I am the youngest of 8 biological siblings.
Okay.
11 total, but 8 biological. And luckily, my oldest brother was a perfect match. And in his defense, he said that nobody else had to go get tested because he already knew that he was going to be the match. So,
wow, that is wonderful, because you know sometimes it don't work that way. That conversation.
A lot of times it don't work that way. Yeah, and not only that, a lot of family members aren't susceptible about doing it for you, regardless. You know, it's just something that happens in the medical community. You know, not just family, but anybody that's a match for someone on the registry. It's not feasible for them because they're not educated about the process.
Right.
So While my brother was doing his workups for to give me his cells for the stem cell transplant, I was doing a clinical trial, which would allow me to do a totally different round of medication, more radiation, and I got into a good area where they was happy with where I was and what they saw, and me and my brother went on through the stem cell transplant.
Okay.
So I did make a complete response from that transplant. So I like to use the word response versus remission. And the word complete, a lot of people think that when you say remission and your cancer come back, you're cured. There's like, how can you come back? How can your cancer come back if you're in remission? So
Right.
I like to use the words complete response. So I tell them I'm in complete response. And I was there for almost 2 years. I was back to living a healthy, new normal life. I'll never go back to the beginning, but
Of course.
my new normal, I was healthy, using that life, living that life healthy. And then again, I started feeling something different. So I called my doctor. I said, hey, I feel something different. I said, what kind of appointment do I have? She said, just your regular checkup, quarterly checkup. By this time, I was going 3 months, every 3 months. She said, just your quarterly checkup. I said, well, can you add a PET CT to my test? And she was like, why? I said, because I feel something different. And she said, okay. She said, you know your body. So I came back to Duke Clinics and went and had the PET CT scan. And by the time I got back to the adult bone marrow transplant unit, my practitioner came in. She was already crying.
Oh my God.
She was like, look, don't worry. We're going to overcome this again. She said, you have, right where you felt, you have a mass this time in your T3 and your T4 vertebrae. And that's the pain that you're feeling. And not only that, you have it in your 8th rib on your right side. So the myeloma had came back doubly, and it was more aggressive than the first time. So my doctor, again, this time she checked the bone marrow registry once again. I still don't have a match on the registry. So she said, what we're going to do is we're going to bring your brother back for a 3rd stem cell transplant. And then, again, while he was doing his workup for the transplant, I started a 2nd clinical trial using a totally different slew of drugs to get my numbers back down. So again, my brother and I go through the transplant, and prior to the transplant, I had 8 more days of radiation. I had 8 cycles of total body radiation, which was twice a day for 4 days. I had a higher dosage of chemotherapy. They call it a myeloablative transplant. And then I got my brother's cells back, and I had to spend at least 30 to 45 days in the hospital because that was normal protocol. So this transplant, the last transplant, was probably the most vigorous transplant that I've been through, all because of the toxicity of the medication and everything that I dealt with, coming through as well, with the radiation, the total body radiation, and all of the medications that came with it. So again, I went through the transplant, very good, very successful. I did my 100 days. Actually, it was 127 days. Now, I had a few hiccups where I had to go back in the hospital a few times. But other than that, the transplant was good. It was a success. So immediately after that transplant, my doctor said, we've never put you on a maintenance medication. So they finally started me on maintenance, which was a IV shot, IV Velcade. And I did that for 1 year consecutive. And after that 1 year, I called my doctors again. I said, hey, can you order me another PET CT? And they was like, why? I was like, I feel something different. And she said, hey, you know your body. Again, they ordered the PET CT. The results came back, said I had a tumor, this time on my T8 and my T9 vertebrae.
Oh my God.
And this time the tumor had came back, and it was in the 5th rib on my right side. So instead of another transplant, my doctors changed mine. I did 8 more days of radiation. So you see this glow, this comes from radiation. This doesn't come from light that I'm on. It just comes from radiation. So I did the radiation. My doctor said, hey, we're not going to do another transplant. we're just going to try you on a different maintenance medication. So I did the maintenance of Revlimid, and again, great results with the Revlimid, you know, and the Revlimid really worked out in my favor because it allowed me to become a living myeloma patient. You know, it didn't stop me from anything that I wanted to do. You know, if I wanted to travel, I pack my medicine up and go and take it at night when I'm ready and go to bed, and the next day I'm ready to go. So I was on that medication for about 8 years, you know, off and on a little bit because I had to get a boost from my brother probably 4 times within that 8-year span. And fast forward to 2019 workup. I'm doing workups right now, so it's all fresh in this time frame of the year. So fast forward to 2019, I do my workup. My doctor said, "Hey, you have a fractured rib on your right side." Never knew I had a broken rib. So she was like, "Well, you know, we just got to watch it and let it heal." So, you know, it healed on its own. I did a chest x-ray a few months later. They said, "Hey, the rib is healed perfectly. Everything is fine." Fast forward to 2020, doing my workup at this time, I go back for the PET CT, and that same fracture that I had the broken rib on the right side, a tumor has now grown on that side. And again, I started 8 more days of radiation, and then she switched my medications this time. I started the Pomalyst, and then she introduced me to Dara and Dex. So fast forward a little bit more, my brother had to come back for another boost. They call it a donor lymphocyte infusion. Allo patients get it. My brother came back for another boost, and he and I went through that. Actually, he didn't have to come back because over the years, they had stored so much that just like most patients do, most autologous patients do with their stem cell transplant, they store them. They get enough for more transplant. They did that with my brother for his lymphocytes. So he didn't have to come back. They used some of the frozen ones that they had. It's probably my 4th or 5th time getting those lymphocytes from them. They gave me the lymphocytes. I went on a drug holiday for 6 months because, you know, the chemotherapy kills the good and the bad. So after that 6 months, my doctor put me back on Palm. Then she introduced me back to Dara, and that's where we are today.
Oh, Lord. It's you hit so many points where I don't know. I feel that multiple myeloma doesn't get the love in the media, if you will, that it should, because it's such a tricky disease where you can just be living a life like it's golden, right? And then poof, it pops back. Now, if you've been reading my little story, I'm in remission, or as you put it, you know, you don't want to use the word remission. And I don't even remember how many years now. I think it's like 3. This year would be 4 with zero spike. What is it? Zero spike in CR. I forget the terms and stuff like that. Complete remission.
Complete remission,
yeah, hello. And sometimes, like, what I tell a lot of people, I live in the present, so I try not to think about the what ifs. Like, what if this crap comes back? Or what if it just gets activated? You know, all of those type of things. But listening to what you're telling me, it's scary. I have to say.
It is scary.
It's scary.
And what you just said, I made a comment, barbershop talk yesterday in the shop. It was a guy talking about it, and I told him, I said, man, and I was just talking about us as patients. I said, we are one doctor's appointment away from living our life, like you said, living the best part of our life right now, one doctor's appointment away to restarting your new normal. Because now you could be back to a different type of treatment, where you have to go to the clinic every day, where you may need another stem cell transplant, where you can't have the freedom of doing everything that you're doing right now, or the pain has gotten so bad that you can't go, like me, I couldn't go back and work out yesterday because of today's doctor's appointments. They was like, okay, don't do that. You know, so, and he was like, man, I've never heard it put like that. And I said, it goes for anything. It goes for everybody. We're one doctor's appointment away from something different.
It's so true. It's like, it's funny because as you're talking, I know I'm feeling great, but I know I do have a pain or two, okay? And I know I've been talking to my doctors, and it's like, you know, deep down, you know how your body is. And that's really important for a lot of patients. You really have to be in tune to a pain, because you'll go to these doctors and they'll be like, oh, it's in your case, oh, it's bursitis or whatever. You know what I'm saying? And you can like a trip and stuff and break a bone. You know, it's just like all of these things. Sometimes I feel like you have to be doctor self, and you can't really let, if you're telling whoever that you're not feeling well and they're not like taking regard to what you're saying, I don't know, it's just to me a slippery slope, because especially if you don't get the right doctor, and sometimes that is the case with a lot of these patients. You know, you don't get the right one, or they're saying, oh, well, I don't know what to tell you, I don't see what you're saying. Because just the fact that you had to ask, give me this other PET scan, you know what I'm saying, PET scan. A lot of people, I don't know, it's just weird.
What it is that a lot of people are scared to advocate for themselves.
Right.
And that's all it is. You know, they feel that it's a stigma, and it's true in some cases, that if me as a patient come to you as a doctor and say, hey, Yolanda, can you order this scan for me? You may think I'm trying to tell you what to do, which, and that it's not like that in any case. It's just me broadening my horizon. It could have been something that you hadn't even thought about, and something that I want done, and let's get it done. And that's a problem that we have today in society. People are scared to advocate for themselves. They don't want that stigma of, oh, I went to school for all of this, and you ain't gonna tell me. It happened to me with my daughter. I just asked my daughter, doctor, could you run some labs for her? And she was like, why? Because I asked you. Why?
Right.
Run some labs for her. You know, and I had to eventually tell her I had cancer, and I want a baseline for my child just to see this is what's going on.
Exactly.
Basically, you know, me telling her what to do, and it's not even like that.
Well, it's funny because one of the questions that I have for you tonight kind of bridges into that just a little bit. But I wanted to, if you see me over here trying to do something, hopefully I don't knock that off. But there was a couple of questions. And, okay. See. Okay. I see some of your peoples up in here.
Yeah, I got my family. I got my family up in here. They rocking the Team Thomas. They got the Team Thomas hashtag on there, so that means I know they rocking the Team Thomas.
There you go. There you go. So we have a person who just said kind of what I said. They said, so great that Thomas has advocated for himself and asked for a scan. So important for patients to trust that they know their bodies. I couldn't agree more. Mm-hmm. You know what I'm saying?
You know, I tell patients that the doctors, they really, the only thing they go by is our labs, our scans, and whatever we tell them.
It's true.
You have to be that voice, because
you have to.
They're not with you at home. They're not the ones that's they're at the clinic, but they don't know the effect that you're getting from the medication. The nurses can talk about what other patients may have said, but they don't know what's happening with you. And the difference is some of the medications, like you and I, we could be on the same medication, but what works for you may not work for me, and what works for me may not work for you. The medication does the exact same thing.
Exactly. And it's funny because that's something a lot of people don't realize. Like when they hear, oh, well, this person has the same cancer, why aren't they getting like the same results maybe as you're getting? You have to understand each person, the DNA, all the component of that one person is so different from someone else. So you can't really look at it that way. Like, why did it do this to this person, but why didn't it do that to you? It's so, the complexity of it all is so deep that you can't really look at it that way. But again, just in terms of just being vocal if you do not feel well is key.
Mm-hmm.
You know, it really is key. And it's funny because I know you said the plasmacytoma, right? I get my words all mixed up with this whole myeloma world. But I know for me, I first was, well, I won't go through the whole thing for those who saw the other episodes or whatever, but I know I did have a radiation treatment, and I tend to forget about that, and that was at my chest sternum. So it was like, just as they're like, oh, you have multiple myeloma, and then you could see right in the middle of my chest, there was like this big bump thing, curve happening. And I was like, oh, that's because of the myeloma. I'm like, get out. You know, so even though my journey was like a 5-year watch and wait, that was something that we needed to like nip in the bud. However, and I think I've spoke about this in some other things that I've done on IG or whatever, but those things that you do prior can lead to other health issues down the line. So now the thing, my cardiologist, she's in tune as to like what's going on with my heart, you know, as I'm getting older. And because since I had that radiation treatment so many years ago, you know, is that going to give me some issues now? You know, because now the only medication that I'm on is for cholesterol. So she's trying to nip stuff in the bud before it could possibly go some other kind of way. However, what I do appreciate about her, she's being proactive. And a lot of doctors, it's a mixed bag. It really depends who you get. But if they do their due diligence, they know your history, you giving them everything that they need, and they take it from there, and then they guide you properly. That usually works to the best, you know,
Yeah.
the best benefit for you, you
Yeah.
know, as a patient, you know. Before I get into my stuff, somebody wanted to know what type of myeloma do you have?
IgG kappa.
Okay, I think that's the one I have. I always confuse IgA or IgG, but whatever.
But I also have I have extramedullary myeloma as well, which
Okay.
basically means I get the tumors, and they track. That's why I get tracked with PET CTs every year, along with 24-hour urine and the bone marrow biopsy and the lab work.
Right, right. Oh gosh. Who is this? LPC for you said when they were first diagnosed with their local oncologist, um, local was the first made something they corrected their doctor and told them that they had it all wrong. Basically, in a nutshell.
She said she's a captain of this ship. So,
Yeah.
that basically
I'm
means
seeing that part.
she's advocating for herself.
Exactly. And you have to,
Yep.
you know. So let me hit up some questions since we're on don't mind a baby running through because he's doing vinyl, because I'm like, what in the world is that noise right now? Okay, let's see. Okay, So to ease into this question just a little bit, I'm gonna try to be subtle about it. But considering everything that you've gone through, okay, we're talking over 15 years, right? How do you adjust to, okay, we've gone through the whole COVID mess, you know, where everybody's still trying to be careful around that. How do you go about triggers? You know, do you find yourself thinking more about final situations? Like, if I'm being subtle, but we're talking, let's be real with it. Like,
Well, I was about to say, don't sugarcoat
yeah, don't
it.
sugarcoat
You
it.
know,
Let me be real with it. But do you find yourself thinking about death? Do you find yourself, if you hear of certain people who die from myeloma or any other kind of illness, are those triggers for you where you kind of reflect to your own situation?
well, let's go back to at the beginning. I feel that everybody, when diagnosed with myeloma, think about death. The death sentence. It's normal. It's natural. Everybody think about the prognosis, the mortality rates, and so on and so forth when it comes to myeloma. I did it. So you know that was an initial trigger for me. You have cancer. You know, what's my time? You know, how long do I have to deal? So one thing about me and my situation, when I was diagnosed, 3 to 5 years was the average lifespan. So in my mind, that was my goal, was to beat those statistics. You know, I did that. However, I relapsed in the process. It was after that second relapse, that second stem cell transplant, when I remember it like it was yesterday. My cousin and one of my friends from Virginia, we went to Myrtle Beach bike weekend, and during that ride, I told them, I said, "Hey, I'm just gonna be frank with you, and I'm gonna be honest." I said, "I have accepted that I have this disease." I said, "I have accepted that I may perish from this disease, and from this day forward, I will live my life to the fullest."
Right.
And that's what it took. It took me to realize that I can't beat it. You know, as strong as I appear to be, I can't beat this disease because I've done pretty much everything right. You know, I was way healthy before I got the disease. I was a little bit healthier after I got the disease, and I was and the cancer just kept coming back. So, you know, okay, I believe the science that this cancer is non-curable. It's going to come back at any time. So I told them, I said, from this day forward, I'm going to live my life to the fullest.
Right.
And you know, when I do hear about other people passing away from myeloma, it's a tough situation, because the first thing that I think of is survivor's guilt. Like, you know what? I've been through so much. They've been through so little. God spared me, but took them. But then
Right.
I think about it, I was like, you know what? I don't want to go. You know, it's survivor's guilt, but I don't want to leave. I still want to be here and enjoy my family and live my life and do whatever I can do and assist with everybody else that's dealing with myeloma. So, you know, it's one of them situations where, you know, I'm really saddened for a lot of people, especially the ones that I'm really close to, because, you know, now I still keep up with their family. And in my mind, I think that some may say, okay, how is Thomas, you know, still here? And they took away my husband, my dad, my brother, my son, whatever, you know. So it's one of them situations.
Right. You know, it's funny. I think for me, it triggers just a little bit. But then again, like I said, I kind of live in the moment, you know, right now. So I try not to think too much of that. And again, as I said before, everybody's situation is different. So you
Mhm.
don't know exactly what they were
Right.
going through and things that we probably didn't know, you know, or privy to and all of that. So once the trigger pops in, it pops back out.
Mhm.
And then I just, okay, let me just focus on what I'm supposed to be doing. You know
Same
what I'm
here.
saying? Um, so yeah, we'll move away from that sad question.
You know, it is a sad question, but it's one that needs to be asked.
It's
You
real,
know,
because I think a lot of people deny, if you will, that conversation. I think in the beginning we all think about, oh, death. You know what I'm saying? Because I know I had my time briefly, and then after the crying and stuff, because that crap was brief. I
you
was
know,
like, okay, what we gotta do, and then just kind of, okay, this is what we gotta do. Okay, boom, 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 and that progression, but not sulk too much in this.
one of my friends, she just logged on, and she just went through her first relapse, and
Okay.
she's done everything that she could do prior to her stem cell transplant. After changed the diet, started exercising, and had her first relapse. And it hit her so hard, and that's what I told her. I said, you know what, this is your first relapse. First of all, I said, go through that whole process. Grieve, ask why me, and then get to the process in your head where, okay, I got to see whatever I can do to get where I need to be. Now, granted, I'm still not telling her to get where I am, because
Right,
it takes a long time to get where I am about my disease.
right.
But you have to go through this process, and then once you get there, then you'll know when you're there.
Exactly. Exactly. Yeah. It was something I was gonna say. I'm just let that
All
let that
right,
go.
we'll get
'Cause,
off this subject.
yeah, 'cause it's deep. You
It
know
is
what I'm
deep.
saying? And like you said, like, we're all on different timelines how this whole thing works. I know when my second doctor, because I did get a second opinion. I ain't gonna go through that whole story again, but I did go through a second, actually my third doctor, when you think about it. Um, I'll say doctor, 2 and 3 words together, but not really. But the third doctor, he was like, okay, I don't remember the exact words. It's so funny. I feel like that was like so long ago, which it was. But like how I come to this in 2022, we've gone through so much. Like some things, some parts of the conversation you truly forget,
Mhm.
and you just, okay, again, I'm in this space right now, and this is where we're at right now. But I do recall him saying something to, okay, myeloma is incurable. I remember those words, and I remember, but we're going to get you to living a productive life. And that's kind of how that situation was. It's like, I guess he was like, okay, I'm going to just tell you now, it's incurable. Okay, so let's look up in the dictionary if you don't know what incurable means. Okay, because that right there says, oh crap. Where you have maybe other cancers where, okay, you do X, Y, and Z, and
Mhm.
then maybe you do get to that cured state. But here you're saying this particular blood cancer, that's not the case. Okay. However, we ain't gonna get to another conversation he's told me as of lately, that there is possibilities. And I think maybe because of the new drugs that they have coming out versus like, okay, for you 15, we're in the game for a bit. So we know what some of those medications was earlier on.
Mhm.
So he's talking a little different now. Cause I'm like, well, I thought you said so and so and so. I won't put that out there in the universe to jinx it. But yeah, he's talking a little differently about things, but still, it's still the whole thing of a productive life, And I think that's something that we all want to do, because we all want to do things. I know you like working out.
Mhm.
We want to do things that give us joy. So if you're telling us, you say cancer, right away you think of, okay, that means I can't do anything that I was doing before. And for those on here listening and for later, let me tell you, you can still do so much. I've still traveled around the world with this. meds and all in my bags. Okay. I still had a cocktail or two, because that's another thing. It was like, oh, you know, that's if you socially drink.
Yeah.
Nobody here is an alcoholic or anything. But if you want some wine, you can still have that. You know, it's like you can still do so many things as well as be healthy. But I think for us, we're living in like a new healthy. You know, it's not how before we got this. You know
Yeah.
what I'm saying? So, but yeah. So, what do you think about, okay, as you see, you and I are black. Okay. So, let's have like a short conversation because I know we're over our time actually. But like I said, we'll just go with the flow. Um, being a black male with this, do you get frustrated when you hear how we're affected, how black people are affected with so many diseases, okay, so many illnesses. Like, do you get like frustrated as to, okay, you're here with this today, you relapsed, like it's like a bubble that you can't get out of. And then as a black person, do you feel like overburdened by all of this trying to get out this bubble?
Yeah, I do. And let's go with the broad spectrum first. You know, with all comorbidities, you know, all diseases, you know, hypertension, high blood pressure, so on and so forth. I do because a lot of those situations we have control of. You know, um, back then, long time ago, long time ago. I ain't telling my age, but long time ago. Um, um, our parents cooked a different way. They cooked to feed 8 kids, or however many that was in the house. You know, they cooked with the fattening stuff. They cooked fried it and so on and so forth, which causes hypertension, which causes clogged arteries, which causes high blood pressure and diabetes. Now we have the tools to not do that. We can sit here and say, no, I'm not gonna eat that. I'm not gonna cook like that. And if me changing my diet is enough to kickstart me getting better healthy and with my health, then so be it. Why not do that? So that's one of the things that, yeah, I do get mad at ourselves because of that. So that's why I always am out here advocating, saying, hey, yeah, I have myeloma, but I'm still doing something.
Right.
And I even go into depth and say, hey, look, you're not where I am. Don't go to the gym and try and do what I do in the gym, but go do something.
Right.
If you start and build your strength up, because I was there, I was at ground zero again, where I couldn't do any push-ups, I couldn't do bench press, I couldn't do none of that stuff, but I worked myself back up. However, during the process, I listened to my body. First, I did get clearance from my doctor before I did
Right.
that. Let me put that out there, so let other patients know that I didn't just do it on my own. I got clearance to do it, but I listened to my body, and I understand DOMS, delayed onset muscle soreness. So I could tell the difference when I'm sore from my workout versus my back pain, where I call the doctor and say, hey, I need to see something different.
Right.
So those are the things that, we could change. If we change ourselves, then those are the things that will help us in the process.
I
Now,
totally agree.
yeah. And when it comes to myeloma, it's so different in the myeloma world because, no one knows why it affects us more than anybody else. However, in the myeloma world, we don't help ourselves because we don't get in the clinical trials. The clinical trials is imperative for us to be in because it shows change. You know, it can show, it's been proven that some of the medications that is out for myeloma works best in African Americans versus
Yes.
everybody else.
Yes.
You know,
Preach.
you know, it's out there.
Mhm.
You know, but because somebody got on that trial and these results came out saying someone showing this, you know, so it's imperative that we get in trials. And I know how it is about the history of blacks in clinical trials, you know, with Tuskegee and Henrietta Lacks and so on and so forth. But we have to make that change. And to me, that's what I want to do. I want to be that face to say, hey, I've done a clinical trial. So sometimes it takes somebody to look like you to be willing to do a trial. Like, oh, this black man, he did a trial. Let me see what happens. Let me enroll in a trial. Let me see how that works for me. And the other thing is the people running the trial. You know, and I've spoken to some doctors. You know, I was like, hey, if you're running the trial, a lot more black people would say, hey, I'll be in that trial simply because you're running it.
Right.
If that's what it takes, so be it. Let's do it.
It's like a whole domino effect. You know, I'm glad you mentioned clinical trials. That wasn't a question, but as we were talking, I was going to throw that in here anyway. What I've noticed from the people that I've spoken with is, and I just had this conversation last week, I feel like there's like this wall. We already know it's that pharma wall trying to reach over to the patients. And then it's the wall of the patients who have concerns about pharma, you know. So whether they yeah, just as Thomas mentioned, being in clinical trials is very important for people of color to be involved. But then there has to be, okay, he's coming back, cool, thank you. But there has to be some better way of going about it. You know what I mean? Okay, cool. Thank you guys for letting me know. Thank you. But yeah, sometimes it has to just be a better way of letting people know that clinical trials is actually a good thing, you know. Yeah, and the VIP status, totally agree. Yeah, I don't get that. But it also, a part of it also is being vocal. You know, just as we brought up, like you can't really go to your doctor and you know you have a pain in your shoulder and then you're not being vocal about it, because that they can't help you if they don't know what's popping. You know what I'm saying? So that's like a whole other conversation. We ain't gonna get started with that. Oh, he's back. Your people are in the comments like he's coming back
I
on.
know, right? Hey, I appreciate the phone calls and texting nephews. Hey, good looking out. My whole entire Wi-Fi just died, yo, for real, for real.
I wasn't sure if it was mine,
I
but I
thought
said
it
I
was
don't think
yours
it's
too.
mine
I thought it was
because
yours.
I'm
And
still
then,
moving.
and then when I got the call, I was like, because I was just here. I could see myself moving perfectly. And I was like, man,
Oh, really?
yeah.
Oh, okay.
I was like, her internet went out. And it was mine all along. So,
Oh gosh. So I was just like wrapping up the whole clinical trial thing, you know, that yes, it is important, but there needs to be some improvements as well as to educate the people, you know. You can't leave it too much on the people because people are gonna have their taboos and you know what they think this that, and the other. But I think it's really farmers' job to do a better job, and they've kind of like dropped the ball to
well,
some degree. You know, even now, I mean, it's a little better as telling people, oh, you should enroll in clinical trials, but you need to do a little bit more. You can't just go about saying it that way. You really, when I say you got to educate the folk, you got to get in there and educate. You know what I'm saying?
you know, it's so many stigmas about trials. You know, no, one of the main stigmas is that people think that just because they're in a clinical trial, they're at end of life. That's not true. clinical trials don't mean that you don't have anything else in the pipeline for you. They're just saying, hey,
Right.
it's a different drug. This is a different combination of drugs that may get you to a better place.
Right.
So,
And
and
it's funny because this is something like the whole clinical trial world is fairly new to me, maybe in the last 4 years or so. Because I know when I first started out, I didn't understand what was happening. I know certain people actually were calling me for these clinical trials, and I just didn't understand. It was just too much going on at that time. But from what I understand, usually with some of these clinical trials, just like you said, sometimes they are batch that, the public hasn't gotten access to. Sometimes it's best to be in a clinical trial based on what your condition and stuff is, because like you say, you may get that combination that can help you along, versus what you were taking. So there's definitely some benefits from what I've,
yeah,
learned about this whole, thing, you know. But we're going to go on to the third question. Okay. So what's your take on self-care? How important do you think it is to your survival? And what do you do in terms of that?
it's very important to my survival. Like I said before, I was a avid exercise person prior to getting diagnosed with this disease. You know, any sport I played it to an extent where very competitive. After the diagnosis, that exercise, that self-care prior to me being diagnosed played a huge factor in my treatment. But it's
Mm-hmm.
the fact that when my doctor, came with these medications or these programs that she may consider with me taking, she didn't hesitate because of the toxicity of the medication. She didn't hesitate because I was in such good shape, So, and her and I did an interview, and they asked her. They said, "Hey, would you do 3 patients on most patients, 3 transplants on most patients?" And she told them no. She was like, "The reason that I was able to treat him more aggressive is because he was such in great shape that
Right.
to handle whatever I threw at him." So that
Right.
played a huge factor in me being where I am. Also, it played a huge factor into me mentally, because exercise was my outlet. You know, when I got diagnosed, when I first left work for my first stem cell transplant, I was in a depression. I was depressed. You're telling me at 36, 35, 36, 37 that I can't work no more. So
Right.
I went into a deep depression. And from that, I used exercise to get out. And granted, sometimes I went to the gym, got a great workout in. The most of the time I went there just to socialize. I used to go there,
Right.
walk around, and talk to everybody. And unbeknownst to me, that was really building up my advocacy, because people would see me in the gym, non-myeloma patients, and they could have the worst day of their lives. And then they'll see me in the gym and they was like, "You know what? You're going through so much. I can't complain about nothing because I'm not dealing with half as much as you're dealing with, and you still got a smile on your face." So
Exactly.
it played a huge factor into me being where I am today.
It's funny because that's like a part, and I had this conversation with a couple of people last year where I find more doctors are telling you to get some form of self-care, and in the terms of exercise. That's why I write, let me form this business as a trainer, you know what I'm saying, for people such as us, to do a little workout. Nobody said you have to get crazy with it if that's not what your life was prior to being diagnosed. However, you should really put some form of whatever, whether it's yoga, whether it's strength training, with your doctor's clearance, of course. But I think that's like a no-brainer. I think everyone should know you need to get that doctor's clearance, because a lot of stuff that I was doing, even in terms of doctor blah blah blah, it's my birthday, can I have a glass of wine? Sure, in moderation. You
Yeah.
can have a glass.
Yeah.
Okay, but that's me having that conversation with my doctor, not me just, ooh, we're gonna have a party, and acting a fool. Okay. So maybe that's not common sense for everybody, but yeah. So, okay, now as we wind down,
Okay.
our final question is, what parting words would you tell the newly diagnosed with multiple myeloma?
Back to what we had already talked about, living our lives. I would let them know that this diagnosis is not a death sentence. Go through the grieving stage. Go through the why me stage. Go through the I can't believe I got this disease stage. Then, as quick as you can get to the why not me phase, and then to the okay, let's see what we got to do to get to this next step phase, the better off you'll be. And then after that, get to a good place where, I'm healthy enough to do something. Live your life. I'll let them know. Live your life to the fullest. Do if you want to do it, do it. Within reason. If you feel like you're comfortable, physically, mentally to do it, do it. And that's one of the things that I tell a lot of new patients. Live your life. Don't let this be a death sentence for you.
Here, here. You and I are here because I don't have to say anything else. I'm totally, that's what I kind of preach, wherever I'm speaking with, and it's funny because I don't know if some people are like, oh, you're just too cheery and positive, because some people are funny. I just don't know. But that's kind of what it is, though. You know what I'm saying? You kind of have to still live and do. But I want to say thank you, Thomas, for having a conversation with me. I want to thank our audience that popped on today, and it was great meeting you. Maybe one day we'll meet in person. We'll see with this COVID mess. But you be well, and thank you again.
Thank you for having me.
Oh, before we end, do you want to tell people where they can reach you? Your IG, your social media, and all of that stuff.
Well, as you can see right now, IG is 846627. And for those that don't understand what those numbers mean, that is my name, Thomas. If you was to look at the phone, the numbers and letters on the telephone keypad, 846627 spells Thomas _Goode.
Because I was wondering, but I was like, okay. Thanks for breaking that down, though.
That's what Buck for Prayers on Twitter, Thomas Goode on Facebook. You reach me on one, you can get me on any of them. So
cool. Thank you.
Thank you for having me.
You're welcome. Bye, everyone.